All right. Welcome, everyone, and thank you for joining me today. We're going to give people a few minutes to kind of pop in here, say hi, and then we'll get started. Hope you guys are all doing well and you're all ready for the holiday season. I know it's been kind of hectic around here, so I'm going to make this pretty quick and straightforward so we can talk about a hot topic that's going on right now, which is sick kids and bronchitis, RSV, all these types of things that we are seeing boatloads of right now in EMS. And so that's what we're going to be covering today. Hopefully you guys are interested in that or excited to learn a little bit more about how we can manage these kiddos and make it a little bit less stressful. That's my goal today. So hopefully you guys are interested in that. So while we're kind of getting all sorted here, getting everyone in, go ahead and let us know where you're all from. Okay, where are you all from? Howard even knows exactly what I'm going to say. Where are you all from? Go ahead and put that in the comments while we're waiting for everyone to kind of pop in here. And we'll get started as soon as we kind of get all the introductions out of the way. Go ahead, throw that in there. Where are you all from? Western New York? Where are you all from? Let's see here. South Africa, right on. Kingsley from the UK, watching from Pakistan. Very cool. Mike from Bay Area. Mike Chris is middle of Tennessee. Right on. Dallas. Let's see over here. UAE, right on. Delaware, Ontario. Our first Canadian like me. Canada, there we are. Antarctica. Okay. You can't just say Antarctica and then not prove it. So you're going to have to like direct message like a proof that you're actually in Antarctica because I want to know now. And if I can, I'll try and ship you something because that would be pretty cool. I have a big map coming of things, place, and we pin it wherever we ship things. And so if you actually are in Antarctica, prove it. And I'll find a way to get you some stuff, which would be super, super cool. Anyways, before we get started, just keep in mind that we do have things that are available for you. So if you struggle with scenarios, these are some things you might be interested in. We do a 100-patient scenario book. This is something that no one's made one of these in about 15 years. And so this is brand new. It's our first edition book. It's been a fantastic edition. It's our bestseller. We've sold thousands of copies already, and you can get one as well in digital form or physical form. We've also made expansions of 25 airway scenarios, 25 MCI scenarios, 25 pediatric scenarios, and I'm working on 25 cardiac arrest scenarios. So there's 200 scenarios for you that are going to be available right away. And these little guys, little report notes. And so if you struggle with giving reports, this is kind of like a fill in the blank kind of idea. And all you need to do is simply fill in the blanks, and then you give yourself a nice, concise, structured report every single time. And they also come with little notebooks that are lined paper. So that way, if you need to jot anything down, they're all lined paper as well. So those are all available to you. You can get them as a bundle. So that way, you're not paying twice on shipping. So anyways, that's my little spiel. And let's get into today's class. Okay, if you are a paramedic student or an EMT student, you're struggling in school or you want to be better, we do have a premium subscription that has any course you can think of that's in that is attached to a textbook. So if you're struggling with something in a textbook, we have a visual course for it. And so what we specialize in is cutting your study time in half by giving you visual content as well as raising your grades all at the same time. So less hard work, more grades. Pretty easy, no brainer. And if you're interested in that, you want to see it to believe it, you can check out a 3-day free trial and we can get you started on that and see for yourself. And if it's for you, stay as long as you like. Okay, let's look at today's case. You are called to an 8-year-old female patient who is complaining of fatigue, increased respiratory rate, dry cough. Okay, on auscultation, you hear wheezing. Okay, you would hear wheezing if you heard the video or you saw the video earlier today. She's pale and says it hurts to cough. She has a fever of 38.9 degrees Celsius and is not drinking many fluids or eating. Just to kind of give you an idea of how she looks, she's kind of quite sweaty, quite pale. She looks fatigued. Okay. And she has that dry cough. And when we auscultate again, we hear wheezes. Okay. So let's kind of first, judging by what we're developing or what we've kind of seen so far with this patient, what do you feel this patient is suffering from? Okay, asthma. I'm glad we were able to help. What are you guys thinking? What do you feel this kid is suffering from just right off the bat? RSV? What do you all think? Epiglottitis, acute bronchitis, asthmatic, viral induced wheeze. I like that answer. Pneumonia is RSV. Okay, I love it. I'm going to go ahead and kind of say that you guys are on the right track, right? Okay, so as far as what this patient is suffering from, it sounds like it's something viral or bacterial, some sort of infection that has taken over. So whether that's RSV, whether that's bronchitis, whether that is I like the way that you described it as a viral wheeze. These are all things that are very kind of along the line. Can we diagnose what type of disease process it is? No. Can we have a pretty good idea that this is something infection or viral based or bacterial based? Absolutely. I think we can all kind of agree that that's very likely what we're looking at here. So despite what is the actual disease process that's happening, we treat them pretty much all the same if they're viral in nature. So let's move on to the vital signs. We do our vital signs, and this is what we find. So the heart rate, as you can see, is 129. The temp is high. It's about 38.6, which is about 101, 101.5. Blood pressure right now is 96 on 61. And then a breathing rate of 36 with an SpO2 of 86. Okay, so not horrible, not great either. So some things that we need to definitely address. So based on these vital signs, do you feel this patient is in a compensated state of shock or a decompensated state of shock? Go ahead, throw that in the comments. Compensated or decompensated? Throw that in the comments. What do you think? Yeah, you guys are kind of all on the right track, thinking probably compensated, not doing amazing, but not doing horrible either. How do we determine that? Well, we know she's 8 years old. So based on an 8-year-old, let's think of it this way. Okay, so we need to go age, or it's 70 plus age times 2 gives you blood pressure, your systolic pressure. So she's 8, so 16 plus 70. So her hard line is what? 86. Okay. 86 is her hard line systolic to be considered hypotensive. We're 10 points above that. So in this particular patient, they would be considered a compensated shock right now. Okay, compensated shock right now. Now there's still things that we need to deal with, because remember, compensated shock always will lead to decompensated shock if we don't manage it. Okay, but right now this patient is compensating. And so that's one less thing that we need to be thinking about in this particular case. Okay, so now that we know that they compensated, we kind of think that this is something viral. So what's actually going on in the lungs? Like, what is actually the issue here? Just to give you a quick little physiology lesson. So you have your functional portion of your lungs, which is your alveoli. Okay, this is where oxygen exchange occurs. Okay, and allows for all those good things to occur: oxygen exchange, CO2, and so on and so forth. The leading tubes, these tubes here that lead to the alveoli, are your bronchioles. And so these bronchioles, during times of viral invasion, they get inflamed. And when they get inflamed, they start to get really, really sore, kind of like and they start to slough that tissue, and they just get really, really sore and irritated. Okay, just like any other tissue that has some sort of viral invasion. So that being said, when it gets inflamed like you see here, what happened to the bronchiole? Go ahead, put that in the comments. What happened to the bronchiole? It got narrow, right? It got narrow because it's inflamed, okay? Because when it starts to swell, which is bronchitis to a T, when it begins to swell, it starts to narrow because that swelling needs to go somewhere. It doesn't go out, it goes in. And then by being inside the bronchiole itself, that swelling, it narrows it out. And so what typical sound do we hear when we have narrow bronchioles and obstructive bronchioles? We hear wheezing. So that kind of goes line in line with what we're expecting with this particular patient. So we have inflamed bronchioles that are causing wheezing, probably due to something viral in nature. Okay, so we know that they're compensating. We know that they have inflamed bronchioles, probably, and we know that it's something likely viral in nature. Okay, so what treatment, based on the vital signs, based on the presentation and the information we've able to gather so far, what treatment would you like to start? Go ahead, put that in the comments. What treatment would you like to start? What do you think? IV for sure to get some fluids in them. I'm totally with that. Yeah. Back-to-back salbutamol nebs. Okay. Salbutamol nebs. You guys are all thinking nebs. Oxygen. Oxygen first. Oxygen. I can get on board with this. Okay. So what would you like to treat with? Well, there's two main things that we can really focus on here. It's managing the oxygenation and managing the shock. Okay, so let's take a look at this. We have the main problem, which is inside the bronchioles, and the fact that the bronchioles are inflamed are causing two issues. One, it's causing hypoxia. We saw that with the SpO2. The SpO is not doing great. It's 86% right now. So we know that we have a hypoxic problem. So we need to limit that hypoxia. The second thing is that in order to improve upon that hypoxia, we can either add oxygen, okay, and then we can dilate those bronchioles. That's really all we can do. Okay, so let's focus on the one that you said first, and that is limit the hypoxia. So get them on oxygen. Okay, so when it comes to these types of patients, okay, if they are below a 90%, then they should get supplemental oxygen. Okay, especially with a breathing rate of 36, it's quite high for her age group. And if you guys had our report notes or medic notes, we actually put the pediatric normal vital signs on the back of it, so that way you can quick reference it. So if you have those, you would have known that 36 is quite high for a 8-year-old. Okay, so they're 8 years old. They have a high respiratory rate. They have a low SpO2. In this particular situation, we absolutely want to give oxygen. Simple face mask. Nasal cannula. I find that kids tend to like the simple face mask more than they like the nasal cannula. You can kind of, get them to buy into that a little bit better. It's a little bit less aggravating or annoying. But you can also use a nasal cannula and tape it as well if they're really kind of young and they're kind of pushing it away and stuff. There's a few options here in order to get that oxygen on them, but I think it's very clear and we can all agree that oxygen is needed in this particular patient. And the evidence suggests that we are correct. Okay, so limit that hypoxia, get them on oxygen. Now, treat the inflammation is a little bit more challenging and quite interesting when you look at some of the evidence. We use things like bronchodilators, we use corticosteroids. In a lot of cases, we actually use antibiotics in order to treat the inflammation that's going on. So let's target each and every one of these to kind of give you an idea of what's going on and why we need to be kind of aware of it. First off, the dexamethasone, or the corticosteroid that we typically use, okay, is typically used and does seem to have some sort of benefit, but not as much as we originally thought. Now, we use corticosteroids quite regularly for bronchoconstriction and inflammation when it comes to asthma and COPD. But viral inflammation is different than irritated inflammation that we see with those types of pathologies. And so corticosteroids, as beneficial as it was in asthma and COPD, it has very mixed results when it comes to viral inflammations like we see in bronchitis. Okay, so that's the one way that we may be able to cause bronchodilation is using corticosteroids. But again, the evidence is not overwhelming. Okay, and here's another one that might shock you is NEBs. Okay, using albuterol and ipratropium bromide in order to try and bronchodilate. Again, the evidence isn't fantastic when it comes to a viral bronchitis as opposed to an asthmatic or COPD inflammation. Unfortunately, albuterol and salbutamol doesn't have a great benefit demonstrated. However, it is still part of our protocols. It's still something that may benefit them. And so we continue to use it as more studies come out. But just keep in mind is that when it comes to trying to bronchodilate a lot of these viral inflammations, there's very limited amount that we can do. And bronchodilators, there's just not a lot of evidence to show that it's actually a benefit. Still use it, trying to get something out of it, but just don't expect a massive miraculous change to these patients because you're using bronchodilators. Because again, the pathology is different and the evidence shows that bronchodilators and corticosteroids have a limited effect on viral inflammations. Okay? And one thing that you might want to kind of keep in mind is that I did say that we use a lot of antibiotics. In fact, around 40 to 50% of pediatrics that have bronchitis get antibiotics because there potentially could be a bacterial in nature. But the majority of these are viral. And we know that antibiotics have no effect on viral inflammations. So even though, yes, antibiotics are very routinely, very commonly used as kind of almost like a prophylactic thing in case this is bacterial in nature, there's really no point in giving it unless you're absolutely sure. So as from an EMS perspective, I don't see antibiotics becoming something that's mainstay in this particular thing because most bronchitis, especially that happens in kids, is viral, not bacterial. And so it's more like a shot in the dark in the hospital setting using antibiotics, maybe finding out if it's bacterial in nature, which it typically is not. Okay. I see a comment here about what about racemic epi or nebulized epi? Again, in extreme cases, you could consider using racemic or neb epi. However, I want to stress again that the evidence is underwhelming to show it. Does it work in anaphylaxis, bronchitis, or COPD, asthma? Sure. There is more evidence to suggest that nebulized epi has a benefit in those situations. Nebulized epi, as much as we do use it in bronchitis, again, has minimal effect on viral inflammations. And so there's really nothing that has, there's no real medication that's making a major impact on viral situations. That's why a lot of things that like pandemics and stuff like that are viral in nature because there's nothing that really helps it. Same thing with COVID. There's nothing that really helped the alveoli other than ventilating them and just giving them time to get over the viral infection. There's nothing that really helped them in those particular cases. And that's the same with any type of bronchitis situation, is that medications really had very minimal effect on viral impact. And so very interesting stuff from that perspective. But something that did come up in the comments is this, is that fluids should be a benefit. Remember that patients, pediatrics get septic too. And we're actually not as good at identifying sepsis in pediatrics. And so what we need to be doing is focusing on fluid replenishment. Remember, they're dehydrated and they're probably septic. They're viral septic, but they're still septic in general. Sepsis doesn't have to be bacterial. It can be absolutely viral as well. So that being said, is this patient dehydrated? Are they septic? Yeah, they are definitely within the parameters of sepsis. And so should we be replacing fluids? Absolutely. And probably in the range of 10 to 20 mils per kilo is very appropriate for this particular patient. Most pediatrics, especially young pediatrics, we usually use a mixed bag. I just have normal saline up here, but we'd often mix it with a D5. Oh, white's not going to work for you guys. A D5W and mixed with the water. So you can actually get bags, liter bags of that D5W as well as normal saline. You can get that mix. And that's often what we use in pediatrics is this mix of this mix of medication or fluids in order to replenish not only the electrolytes, but a little bit of that glucose as well. Okay. Any questions with what we've covered today? Go ahead, throw them in the comments. It was wheezing, Red. Does this count as CEs? I'm glad you asked. So we actually take our cases and we put them into our interactive technology on our subscription, our Mastery Medics subscription, and we do offer these cases as continuing education credits. So absolutely, you can get credits for these classes as a premium Mastery Medics member. Thanks for asking. Okay. Anything else? I love the teaching. I'm glad you like it. I think there is a confusion. People think you're saying acute is only viral. Can you clarify, please? No, acute can be viral and it can be bacterial from an inflammation perspective. So this is a viral basis, what we have here, not a bacterial basis, but they can be acute. I believe I'm answering that question appropriately. Sorry. When does the heart rate kids math equation stop being useful? Probably about age 12. So an acute case of bronchitis is more or less viral in nature. Typically will be viral in nature. Typically, yeah. No problem at all. Okay. Well, thank you very much for joining me. Again, like I said, we have our new notes out, and just so happens that we have pediatrics on the back of these. Okay. The vital signs parameters, as well as the pediatric assessment triangle. And if you struggle with giving reports, we do have a little report fill out. You fill out the blanks, and then you simply call the hospital and you give this report, and you give nice structured reports. And on top of that, you can also pair it with our 100 patient scenarios and our expansion books as well, and get access to those again in digital or in hard copy form. We have both of those on our website at mastermedics.com. We would love to ship one out to you, especially the guy from Antarctica. I still need proof, and I will send it out to you, and that way I can put a pin right in Antarctica. That'd be pretty cool. So thank you so much for joining me and having a little bit of time to talk about pediatrics and sick kids, especially with patients that we are really struggling with right now. The biggest things, again, are going to make sure that we are oxygenating them appropriately and getting fluids on board for them. Those are the two big things, and just buying them time, waiting them out, giving them the energy and the supplements that they need in order to get through this viral thing, because truly it's time that allows us to get past these viral things, and just supplementing those things and assisting in buying them time and giving them time is really what we need to be doing. Yeah. So that is the end of our live case study basis. So we're not doing any more lives. I'm live right now. I'm not recorded. I'm live right now. This is the last one for 2023. So what are we doing for the next few weeks? Next couple of weeks, we do something called the 12 Cases of Christmas. And so I've had myself, Ben, and Dean all prep cases for each of cases that are going to be brought out every single day. So we're going to do a case a day, and we are going to, again, broadcast the question in the morning and the answer in the evening, afternoon. So that way you guys can get all your answers and get all your education that you want throughout the day. So that's what we're going to be doing for the next 12 days. And then we're going to to our regular programming after the New Year's break. So right around the 4th is we're going to return to things and get into medical topics. We're out of pediatrics into medical topics. So that's what we're doing. Again, we are going to be doing a lot of cases over the next few weeks, but they're all going to be recorded, but they're going to be just as enjoyable. This is basically the same format that you've seen here. So you can expect your first case tomorrow is going to be our case 1, and I believe we're going to start with head injuries. It's going to be a mix of different cases. So I think you guys will all enjoy it, but I will leave you for now. I don't see any more questions. No problem, Matt. Thanks, Chad. This will be posted on our Instagram. Unfortunately, I can't post long form stuff on TikTok. That's where you are, but it will be on Instagram. Yeah. Okay. Have a great Christmas. Have a great holidays, and enjoy the rest of your time in 2023. And we will talk to you next year in 2024. Bye for now. I will send in the Caribbean. Yep. Just shoot us a message if you get an error on our website. But I will send to the Caribbean.